Hi, Bedford Chiropractic Clinic, Dr. Sandhu here. It's Halloween and we have some incredible witches that have come in today with their Dracula father for some treatments. So what we're going to do today is we're just going to have a look and just see what we find, and we're just going to treat sort of whatever comes up. So, Molly, this is Molly. So darling, we're going to see how strong you are, okay? So what I'd like you to do is just push up with your arms as hard as you can for me. So, whoa, gosh, that's strong. And this side, wow. And push back to me and towards me, fantastic. And pull down towards the floor, pull downwards, wow. So no problems with the shoulders, really nice and strong. That is beautiful. Push down this way for me, darling, push downwards. Very good. Push backwards, fantastic. Now this side. That is brilliant. You are amazing. Now, let's stretch you out. Stretch out. Oh. Okay, so we've got a little bit of a difference there. Okay, that's just an indicator of a very tight, sort of a tight psoas, which is the big hip flexor muscle here. So we're just going to loosen that up for you. Is it okay if I just tickle you in here? Is that all right with you? Is that okay? Are you ticklish? Yes, oh, I think we've got a tickle point here, haven't we? We got a little tickle point. There we go. There we go. Well done. Now, let's have a look. See how we're doing now. So stretch out for me again. And fantastic. Now, the psoas muscle is a very, very common muscle that gets tight in all of us. It's one of the biggest muscles in the abdomen. It's one of the most important muscles in the abdomen, because what it does is it actually sort of can aggravate the lower back because it has attachments into the lumbar discs. So it's a really important muscle to keep loose. And in children as well, because especially with all the running around that they do. So all we're doing here is we're just giving Molly a little bit of a stretch, and none of that was uncomfortable, was it? No? Brilliant. Up you come for me then, and now. What we're going to do now, Molly, is we're going to stand up in line, and we're just going to look up there and look, wave at Adam for me. Wave, hey. That's it. And we're going to give you a big hug. You alright with that? So a little bit of a hug. So a bit of a stretch in the back there for you. Now, darling, I need you to lie down on your tummy. Would you lie down on your tummy and you can look through that hole there for me? That's perfect. Shall we just lift your head up a little bit? You can put your head on there if you like. You'll be a bit more soft there. That's it. Head down, head down. That's beautiful. So, Adam can just come a little bit closer for me. So if we just look at the feet here, we can see that there's a little bit of a difference. Yeah, can you see that for Adam? Yeah. So what that is indicating a little bit of a stiffness right in here, in that sort of pelvis. So we're just going to loosen that up, and we're going to use a very gentle setting. We're going to use a setting 1 here on this activator, and just there and there. And if we recheck, you can see that she's level. And this again is very common. It's obviously with all the walking and sitting and falling that we do, this joint can get very, very stiff and tight. So we're just going to loosen up the one above as well. Now, we're going to just go up the body and just check. And we're going to just go, right, okay. So we've got a little bit of tension in there, so we're just going to loosen that one up as well. And that one. Not too bad up in here at all. I'm just going to have a quick look in the neck now. And lift your head up for me a moment. That's it. And look up. Now Molly's very, very good. Okay, she's quite loose. Just a little bit of stiffness right on the right side there. Is that a little sore there, yeah? Yeah, just a little bit. Okay, so very gentle setting, and we're just going to loosen that up. There we go. Fantastic. You were amazing. Well done, you. That's fantastic. So well done, Molly. So brilliant. So amazing. Would you like to come and join us? Okay. So would you like to lie on your back? Actually, just turn around for me, Adam, and look at this costume. Wow, look at that. That's really clever. Okay, on your back. So just like what you did there. That's fantastic. Good girl. Lying on your back. Brilliant. Good. So now just push up for me. Let's see how strong you are. Very, very good. And push back towards me. towards me. Very good. And pulling that way, hard as you can, that way. Good girl. Now, pull down, push down. Very good. Push back. Brilliant. And push down. Excellent. And again. Push back towards me now. Brilliant. So very good. So no problems in the arms or shoulders there. Let's check your fingers a minute. Can I just pull these down just a little bit? So again, the same side on that side. So if we just test it, we're actually going to test this muscle. So would you like to just lift this leg up for me there? That's great. And hold it there for me. Hold it. Now push back towards me, hard as you can. Okay, that's not quite so strong. Just try this side and just push against me again, hard as you can. So push up to the ceiling. And she's much, much stronger there. Because a tight muscle is going to be much weaker than a loose muscle. Bend this knee for me, bend this knee. That's great. And we're just going to loosen up in here. That's good. So another little tickle. That's good. And she's doing great. Beautiful. Well done. So it's the muscle right in here. So we just loosen that up. And there we go. Fantastic. So up you come for me. Brilliant. And just look straight ahead for me. That's great. And we're just going to have a little look in the neck now. Who's this, the dog? Who does the dog belong to? Is it you? What's the dog's name?
Lucy.
Lucy. Wow. And look at Lucy's all dressed up as well. Oh, fantastic. Can we have a look at Lucy?
Lucy?
And there's Lucy. Wow. That is brilliant. Well done. Fantastic. Come. Would you mind lying on your tummy for me? That's great. Beautiful. Perfect. Perfect. That's it. Head straight down. So, we're just going to have a look here and wow. Can you see that? Yeah? So if we go up, oof. Way.
She has had a fall down a couple of stairs.
She had a fall down a couple of stairs.
Yeah.
Okay. Stay where you are, don't stay like that. That's it. We're just going to get this more comfortable for you. Yeah, so she's quite sore there because she doesn't like me pushing there at all, but this side she's okay with, so she's flinching every time I touch her there. So the little fall there that she had has actually strained this joint a little bit. So we're just going to get that loosened up. So we're just going to go to that ligament there, and then just there. Right, and if we have a look now, beautiful. See that? Yeah? You see that? So, how's that feel now? She's not flinching, so that's a good sign. Very good. Now, would you mind putting this arm behind you right there for me? So, children need chiropractic care just as much as adults do. And in fact, sometimes a little bit more because they tend to sort of have a few more falls, a few more sort of knocks than certainly we do. One of the worst things we do to ourselves is we sit all day. Yeah. But the challenge that we have with adults is that we basically have left the problem for so long that it's become sort of a habit. It's become ingrained, and our muscles have got used to being in a specific way. So adults can take a little bit more of time to get better, but turn your head to the right. But what's our focus here in this clinic is really to sort of help you get to the best health you can, not just purely being reliant on me, but actually sort of, with our help, educating you in how you can help yourself as well. Danny, would you mind turning your head? That's great, perfect. Yeah, she's doing really well. So it really was the pelvis that where the problem was. Head back to the center. Beautiful. Each movement that I'm getting Maisie to do is basically giving me a pinpoint as to where the problem in her body is. Turn your head to the left now. That's marvelous. Perfect. So, there we go. And much better. Thank you very much. Up you come now. That's great. So, for them coming in today, one of the things that we've committed to doing was we're putting £10 towards Great Ormond Street. But Dad has also taken the effort to get trained as well. So would you like to come and lie down, Dad?
Shoes off?
No, you can leave them on.
Oh, okay. On my back?
On your back, please.
It's not real.
Fantastic. Right, so let's have a look then. So push up for me. Right. And push back towards me. Brilliant. And again. So each one of these muscle tests that we're doing here is just checking to see whether the connection from the nervous system to that muscle is working. Okay, push back that way. Okay. And he hasn't got any strength there at all. It's quite weak. You feel that connection probably, yeah? So we just go there, push up again. So if I actually push on around sort of his thoracic, around T1, T2 area here, and I stabilize it, then all of a sudden he's got his power back. Because that is where the nerve supply to that muscle that is weak on him is coming from. And that's what we need to treat, because that's where the actual origin of his problem is. So we're just going to adjust that. Put it back onto a full setting. And just relax for me. There we go. And all I've done is I've just adjusted his thoracics here and here. And if we have a look now, push back that way. And he's got full.
That's massively
power
different.
back. Yeah. Push backwards against my hand. And push downwards. Beautiful. So he's fine on that side. So let's check this side now. Push up for me. Good. Pull that way. Very good. Pull down. Excellent. And push back. And push down. The body can hold onto these weaknesses, and you may be totally unaware of it. But sooner or later, that muscle that isn't working properly is going to let you know, because the joint is going to then get tightened up, and pain is the last thing the body gives you. It's not the first thing. Pain is just the body's way of telling you that something's not right and you need to do something about it. And what we do here is we basically obviously help you when you're in pain, but the idea is that we also help you to not be in pain. And surely that's a better thing. Arms up for me. Okay, now Dad is actually shorter on this side, so if we just test that muscle on Harvey. Now, big strong guy, and you're training quite hard at the moment, aren't you? Yeah. Hold that leg there for me, and stop me pushing down, and he's just got no power at all. But if we test this side, push back towards me, it's got loads of power, yeah? Now why is that? Well, loose muscle is going to be strong because it has much more ability to contract, whereas a tight muscle is going to be weak because it doesn't have the same capacity to contract. But what that also means is that muscle then is going to aggravate other muscles, it's going to aggravate the joint because it's not going to be working to its full capacity. So we're just going to loosen it up. And pull up towards you as hard as you can. Pull upwards, that's great. And pull up towards you as hard as you can. That's great. And again. Good. So if we test the muscle again, hold it there and stop me pushing down. And I can literally jump on it and it's nice and strong.
Wow.
Excellent. Up you come for me. Now, can we stand at the end of the bench there? That's perfect. And look straight ahead for me. And this arm here. Take a big breath in, breathe out. Beautiful. On your tummy. So we just did a little release of the stiffness and tightness in the shoulders, which the majority of us hold onto. So Adam, if we can have a look at the feet here, you can see that there is quite a difference in his leg length, yeah? And he has been training quite hard at the moment. So we can see that when we do that, it goes a little bit longer. Now this is an indicator of a tight stiffness in this joint and this muscle in here. So we're just going to loosen that up. And as I said, this is such a common finding in people because we basically tend to favour one side over the other, and we tend to sort of unconsciously, we also tend to sit for too long. Sitting is the bane of our health, really. So if we have a look now, he's level,
Do you know, the funny thing is I hadn't actually told you that, but that's actually was where it was hurting.
Well,
I hadn't told you.
No, absolutely. But your body told me. Yeah. You don't actually need to verbalize it. The body will actually say, what is wrong. And he's definitely got some stiffness right in here in this SI joint. So we're just going to loosen that up a bit more. And each movement that I'm doing here now is basically putting a stress on a specific part of his body, and the response is being shown by the leg length. Right arm behind you. There's 50 years of research going on into this. Arm down, left arm behind you by chiropractors and other sort of specialists, orthopedic specialists, therapists. Both arms behind you. It's ongoing research. Activator is one of the few sort of chiropractic treatments, arms down, which actually has lots and lots of research based behind it. Right arm above your head. It's also gentle. And there's the old diversified chiropractors where they used to jump on you. That's where I learned, but I didn't actually enjoy having it done on me, and I certainly didn't enjoy doing it on patients as much as I enjoy what I'm doing now, because it's much gentle and it's quite objective as well. Both arms above your head. Okay, now we can